And Cindy just hit record. So whenever you're ready, Kelly, I'll just keep letting people into the space and I'll go through those introduction slides and then hand it over to you and Allison.
Thank you. And I think Allison's actually going to pull up our slides and get us started. So I think she's working on that. But thank you guys for being here.
Yeah. Yeah. Kansas, Grand Rapids. That's somebody I know. All right. Well, welcome everyone to the first session, one of two on grant writing basics. We're going to spend about an hour and a half today with Allison Kelly and Kelly Milligan. So if we want to just confuse you, I'm Chris Kelly. So we have all the Kellys covered today. You can go to the next slide. Just a disclaimer that funding for this initiative was made possible by a SAMHSA grant, and that the views expressed here today do not necessarily reflect the official policies of the Department of Health and Human Services. Next slide. Always, if we want addiction destigmatized, we need a language that's unified. So we want to be mindful, always to use person first language and never describe somebody as their disease or their diagnosis. And this is our pathway to receiving technical assistance. So technical assistance is just a broader term for resources, support, consultation. So you can submit a request through our website. So that's probably the website you went to register for this session. We have a technical assistance manager who reaches back out to you and connects you with one of the team leads. So like I'm the team lead for the RCO capacity building work. And we talk through your needs and see if we want to pull in outside consultants to work with you, or if there's just some resources you need that we can connect you with. And then at the end, you provide just a little evaluation and let us know how we did so we can always continue to improve what we do. Just a few housekeeping notes to remember. The presentation today is being recorded and it will be posted to the Peer Recovery Center of Excellence website so that people can come back and also learn from this wonderful experience. We always strongly encourage people to have their video on. Our intention is to have these sessions be interactive. So the things you say and the things you do and the information you share with Kelly and Allison just makes the session more rich. If we have an opportunity to share and you come off mute, please identify yourself so that others know who is speaking. Throughout the presentation, you can continue to put information, questions, comments into the chat. And if anything seems pressing, I'll ask Kelly or Allison to pause and respond. If not, they might know that we're getting to that information in a little bit. And we will be posting the slides for this presentation again on a landing page that's specific for this nonprofit capacity building series. So I'll be sure to get that link to you so you can access the information. And then always at the end of the second session, we appreciate and value your feedback. It lets us know, again, what we're doing well and where we need to improve. And I think that is my last slide for the introduction. So I'm going to hand it over to Allison and Kelly. Welcome and thank you for being here.
Yeah, well, thank you, Chris. And I'm glad to see we have 44 participants in the waiting room or in the session today. 44 is my favorite number. So let's not let anybody else in. Just kidding. Well, welcome. I'm glad that you all are here. It's wonderful to see so many of you on video as well. That makes these sessions a lot more fun and engaging. So here's an agenda for today, and I want you all to know who we are. And so Kelly, I will introduce you and you can introduce me. Does that work?
Sounds good.
Well, I love we have all these Kellys. Do we have any Allisons or Kellys in the room? That would be really funny. Anyway, so I'm Allison, but I'm going to introduce Kelly. So Kelly Milligan works with me. She's worked with our organization, which is AKA, for a couple of years. Kelly lives in Sacramento or outside of Sacramento, Elk Grove. She has a daughter. Liera is 3. And Kelly loves adventure, outdoors. And what I love about Kelly is she has a lot of integrity. And as far as a teammate and being on a team, grant writing and anything else, she gets things done. She is so dependable and ethical, and I just love her. I love her spirit. She has an expertise in almost everything. She's way smarter than I am, but I think probably what we go to her for the most is anything trauma related. And she's just a wealth of knowledge in that. So that is the wonderful Kelly Milligan, and I will toss it to you, Kelly.
Thank you, Allison. So I've worked with Allison, as she's shared, for several years prior to working with her at AKA. Allison has done a lot of work with tribes and tribal organizations, as well as universities and nonprofits. So Allison is the principal and founder of AKA, but first and foremost, she's mother to a beautiful 14-year-old girl named Caitlin, who was just dropped off at camp this morning. So she raced back here so that she could provide this training for all of us today. But Allison has her doctorate in public health. She has lived in Alaska and New Mexico, and she is a professor at the University of North Carolina. That is one of the many things that she does, but she's an evaluator and researcher. But first and foremost, she is a writer and an author. So she has authored 4, maybe we're working on 5, to the 5th get published, 5 books, the latest being a healing novel that was just launched in June. So I encourage you to check out her writing and her work because it's brilliant. She's done this work for about 25 years, as I shared, working within communities, advocating for communities, working with tribes to write grants and to get their work published. And so she's got a lot in that realm as well. So I'm excited to work with her and learn from her. And I'm excited that we all can learn from her today.
Yay! Well, thank you, Kelly. And I'm in recovery. I've been sober for over 2 years, but sober from not just alcohol, but all things. So I love the healing path. I walk on it every day. Some days I'm better than others, but if you all are in recovery, you know that's just part of the walk. So thank you for that introduction, Kelly. Love you, and I love that we get to do this. So this is an agenda. We won't cover everything. I was thinking about this workshop. I was on vacation. I just got back today. And I thought, well, how do we cover everything we know about grant writing in an hour and a half, maybe 2 if we do the second session. But we're going to try. And so today is just kind of a taste of what we think that you all should know about writing grants, and you all will teach us things about how you approach grants as well. I'm sure we have lots of grant writers in the room and love that process. So this is the agenda. We encourage you to use the chat box, and Kelly will be monitoring the chat box. If you have questions, ask them when they come up, because there's no time like the present. So and just a little bit about our organization. You can check us out on the web. This is a theory of hope model that we put together that kind of sums up what we're about, what we work toward every day, and what we value. And so we love working in communities. We love recovery, and just love that we get to be here with you all today. So as Kelly said, we work throughout the nation with a lot of different people and organizations. And one of the things that makes us unique is that we focus on organizations that really promote healing, or that areas where we can step into and create a healing space. So that's really the theme of everything we do. And I know it's probably a theme of what you all do too, if you're working with a nonprofit or with recovery organizations. So if you haven't done so already, if you can just type in the chat your name, organization, and role, and if you're in recovery or healing or not. So maybe you're not, but maybe today is the first day of that. And then a fun fact about you. So I recently did this at a workshop with a bunch of youth in Portland, and I had to think, gosh, what is something fun and interesting about me? And I wrote that I restored an old bus and I could live in it if I need to, and it's sitting in my backyard. So I don't know if that's fun, but it's definitely not your normal thing that most maybe grant writers do, live in an old bus. But would love to hear from you all and where you are at in your recovery walk and what you're doing. And I love that we have a lot of people in long-term recovery. And again, recovery is a beautiful journey, and I'm glad to see so many people that are sharing that. So we have somebody from Albuquerque. Yes. Okay. New York. Love it. And Ashley loves bow hunting. Okay. We have a pretty big shop today, so we probably won't be able to go through everybody's fun facts, but if you get bored, check out who's in the room, take a brave step and message them, say hello. Maybe you'll find somebody who has common interests as well. So we're going to get to it. Nothing to it but to do it is one of my favorite quotes I heard a couple of weeks ago, and I was like, oh, this is for all the procrastinators anyway. So keep on typing if you haven't done that. And I I love art. I'm not an artist, but I want to be one. And if we have any artists in the room, raise your hand. Let me know how you'll draw this. But I want you to draw and take a sheet of paper and a pen and draw an empty glass. It can be any kind of glass. It doesn't have to be this glass that I've drawn on the slide deck. And once you have the glass drawn, put it up in the mirror, the camera, so everybody can see it. I think mine might need a handle. If you have colors, oil pastels, anything, you can do that too. That kind of looks more like a mug. Okay, so when you have drawn your glass, show me that you have done it. No judgment on the drawing either. Okay, we've got Wendy Ness has drawn hers. Ooh, I like that. That's a nice looking mug there. Okay. Really good. And anybody else want to share theirs? How about you, Lydia? I love we have so many people on video. Thank you for, having your videos on. Okay, well, I think that's probably enough time to draw. Oh, we've got somebody with 2 glasses. Debbie, you get an A+ because you have 2. I love that. Okay, so now that you have your glass drawn, I want you to think about your organization and kind of where you're standing at today. And because we have so many people, I don't know if you work like for a university or if you're in a nonprofit or where you stand, but that's okay. I want you to fill up the glass based on the amount of resources and abundance that you have today. And so you can fill it with anything. It might be coffee or kombucha or whatever you want, but you want to mark the line as far as how full you are with abundance and resources, partnerships, like how full is your cup or glass? And it's not a class, it's a glass. Oh, I love it. Okay. Okay, so Debbie has done a really nice job of coloring in pink. And Debbie, it looks like you're about half full. Would you say that? Okay.
Yes, I would.
Okay. Anybody else have a glass that they want to share where they're at? You can also type it. Maybe you don't have any writing utensils, so you can. Okay, Wendy's got hers half full. Michael, yours is kind of just getting there. Is that right, Michael? You're at the bottom, like maybe a 10th full.
Yeah, we're about a 10th full.
Okay.
I don't know.
Yeah, that's good.
We're hoping to get there though. Get up here.
I love it. Okay. So, and mine is pretty full. I mean, you can see from this glass here, and then on my sheet, I'm feeling pretty full. But the reason why I wanted you to do that is because I want you to approach grant writing from a lens of having abundance. And I really believe that that is absolutely key. Think about everything that is filling your glass right now, even if it's not a lot. Maybe you're just on that, just getting it started, like Michael. But I think we have to look around and see what we have, and then add to that. And so the theme of this writing session today is all about abundance and thinking about that glass. And so we have a few learning objectives just because I guess we need to put them in there. We thought about what do we want people to learn, but hopefully you'll take away more than just these things today. So was anybody in today's session, were any of you in the data workshop session we did a few weeks ago or a few months ago? Raise your hand. I think I see a few people that look familiar. Joyson, were you in that session? No.
Melanie
Okay.
was. I saw Melanie's hand raised, and I remember.
Oh, okay. Love it. Okay, Melanie. Well, thank you for coming back. So, you know all about our love for Kahoot, and Kahoot is an online game that I think is just the best thing ever. So we're going to play it just to have some fun. You can play this on your computer. You can play it at your desk, but we're going to get going. So Chris has put the Kahoot in there. I'm going to start it. We'll just take a minute and it'll give you a pin. So just bear with us here. We want to go for like 100% attendance, I think that, or participation. So it's going to give us a pin in a minute. And this is the pin. So if you want to type that in the chat box, Chris, that'd be great. It's 180-8380. So you got to have that pin or else you might be joining another game and who knows what that game is about. So we'll wait. So it'll ask you to join and then you're going to type in a name. And I encourage you to use a name that maybe isn't your own. Maybe it's one of your favorite characters or movie stars, authors, legends.
I did want to say, Allison, two things. I had someone mention that when you talk to the side, we can't hear you. And then otherwise it's been fine. And then if people, like I went to the link and it says I have to sign in, but I think if you just go to the Kahoot site, Kahoot it, you don't have to sign in. Does that sound right?
Yeah, that sounds really good.
I'm going to do another link in case somebody doesn't want to create an account. So I put the second one and then you can just enter that game pin, the 180-8380. Does that sound? I'm going to play along here.
Okay. Well,
now, yeah, there we go.
Okay, we're getting some people. And, thank you for telling me about the volume quality. I had on my agenda to get an external mic and I just didn't get it done. Well, I have one ordered, but it's not coming. So I'm going to stand really close to my computer. So you guys are going to get like the full in version of my makeup today and face. I apologize if it's scaring you. Anyway, but hopefully that will help because we definitely want the volume to be good. So let's see how many other people that we can get. And if you're just joining, like Elizabeth, we're glad you're here. We are playing Kahoot. And to play the game, you type in www.kahoot.it, and then you enter the PIN. You can also scan that QR code. So because we have over 50 people, I say we get at least a couple more brave souls to join the party. And if you're having technical difficulties, we are here to help. Okay, we're going to start the Kahoot, and if you want to join late, you can. So we have some fun players. Okay, we want to know where you live today. So take your cursor and drop a pin to which state that you're living in. If you're in Canada or maybe outside of the US, that is okay too. You can just drop it in maybe the white area.
And Allison, we can just see the slide still. I didn't know if you wanted the Kahoot screen up.
Oh yeah. Let's see here. Stop share. Let me see here. Okay. How's that, Chris? Okay. So we have a lot of folks from New Mexico, Oklahoma, Virginia, Minnesota. Love it. So who's from Utah? Will you tell us where you're working and living at?
Yeah, I am working at USARA. I live in Salt Lake City.
Aha, love it. Okay. Well, and thank you all for being here. And let's see, I'm just looking, it looks like some people cannot hear me. Kelly, will you let me know if you can text me or let me know? How's the volume? How's the volume?
Volume's good.
Okay, I'm not going to move from the spot. Here's an open-ended question. What is the best predictor of recovery and healing? Type your answer. And we have a little bit of time on this one. So again, the question is, what's the best predictor of recovery and healing? And, you know, we know a lot about healing from the research that we do, but I think that there's a lot of healing and recovery that happens that's outside of the published literature. So I encourage you to share that. So share what you think is helping people recover. And I love Aubrey. So the best predictor of recovery, in her opinion, is the true, authentic desire to change. It starts there. Oh, I love that. And yeah, if you're not able to join on Kahoot, feel free to type your response in the chat box and we'll get it that way. No worries. Kahoot is not for everybody. I think students either love it or they hate it. Okay. 22 answers submitted. Let's see what they say. Not seeing them. Oh my goodness. I love it. And Kelly, are you seeing that okay?
I am, yeah.
Okay. So lots about community, support, connection, authenticity, hope. Okay. We're going to save this. I love that you all shared. from your perspectives and what you think is the best predictor of recovery and healing. Here's another open-ended question. Why are you here today? And this can be totally anything you think. I mean, you know, being authentic and true is the only way, right? So we did this last time and somebody said because they were bored and they didn't have anything else to do. And that's totally fine. Okay. Let's see what people said. Okay. So a lot of people want to learn about grant writing, and that totally makes sense. I love it. And okay, and then, you know, people have lost grant writing staff and they need it. They want to make an impact, expand their toolbox. And I love the money signs, abundance. Somebody said a UFO dropped them off. I think I read that. And that's good too. We're glad that they brought you to us. So these are all really good reasons why you showed up today, and we're glad you're here. We just have 7 questions, so we're almost done. But we want to know, what is your experience with grant writing? Would you say none, a ton, or some? So you just pick one answer that best describes where you're at today. Okay. So it looks like the majority have none to some experience, and nobody has a ton. So that is definitely good to know. And then we have lots of people in the chat box: Betty, Carrie, Taryn, Barbara. All of you all said none. And that is good, because that's why you're here today. So after this session, you'll have some experience. So I also want to know, what are some abundance gap areas in your organization? And when I talk about abundance gaps, I mean areas where you want to create abundance that you don't have it now. That might be sober living, clinical staff, hiring a grant writer, funds for prevention, funds for medication-assisted treatment. It can be a lot of different areas depending on where you stand. Okay, housing, transport, staff, national reach. Okay, very good. So, and that one, we didn't allow for as much time. So if you were typing and it cut you off, please feel free to type in the chat box. So Barbara and Carrie said staff, transitional living, housing, harm reduction, follow-up. Ooh, all of these are really good. Mental health support. Okay, housing, lots with housing. And we see that a lot too. So thank you for sharing that. Okay, what is getting in the way of your grant, of you writing a grant? And this, select all of these that apply. So you might have a lack of skills, lack of time, no support, limited organizational capacity. If you select other, type it in the chat box. You could also take a photo of something that's getting in your way of writing a grant. Carrie said knowing where to start and what grants are available, lack of experience. Okay, so most people said the lack of skills was kind of getting in the way, followed by limited organizational capacity or readiness, and lack of time and no support. For the person that selected other, if you want to unmute yourself or put your response in the chat, we'd love to hear what that other barrier is that you selected. Looks like there's some other notes in the chat. So knowing where to start, lack of experience. Okay. And our last question, what are the greatest resources in your organization? And this kind of goes back to thinking about that glass and everything that's filling it up. So you can type a couple of responses and think about what that looks like. Willingness, people in recovery, workers, people. Oh, I love it. Man, there's such a theme here of people, of humans like showing up and having you know, an enthusiasm and a presence for the work that we do. Okay, and Carrie wanted us to repeat the question. So Carrie, it's what are the greatest resources in your organization? And then some person typed in they weren't sure with a and let's see, staff. Okay, does anybody want to share why they wrote what they did for this last question? Or maybe you didn't type anything and you would like to. Okay, so that is our Kahoot.
Share.
Oh yeah, please share. Yep.
So we have lots of support in terms of, you know, we have, I'm a peer recovery specialist and I'm the coordinator for Open Door Recovery Center. My name is Candace. We're in Asbury Park. We service Monmouth County and we're in New Jersey. So we have the support in terms of, you know, the company that backs us in terms of their willingness to say, yeah, go forward, do this, do that event. That support is there. There are people who are in the community that definitely support us to say, yes, come on in, you know, tell us about your services so that we can get that support that you provide to the recoveries available, make them available to them and aware, you know, the awareness. So that's why I use the word support.
I love that. Does you know, and support is absolutely essential to everything that we do in recovery, but then also in grant writing. And so we'll talk about that. And I love that there was a theme of people and just the spirit of people showing up and wanting to do good work. So we're gonna, now that our Kahoot is over, all that great music has ended, we're gonna switch over to looking at some content. And let me just switch back to my screen here and we will get going. So let's see here. And are you seeing my dog? You are, okay. For some reason it's not, oh, there we go. Let's just cruise through these. The double screen thing is always weird when it goes into presentation mode. I don't know. So you all know what a grant is because you signed up for the workshop today, but a grant is a sum of money that is given by an organization or a foundation for a purpose. And we're going to keep things pretty high level today because most of our attendees don't have a lot of experience. But I want you to know that if we don't cover things, there's another session. And then Kelly and I are available afterward if you have any questions. And Jody in the chat box says an Australian Shepherd. I'm a BC person. Love it. Okay. So with the theme of abundance, I found this quote and I love it. It says, no one has ever become poor by giving. And that is really a theme of our organization at AKA and a lot of the organizations that we work with. So the spirit of generosity and giving is there. And it's because we have been funded by a ton of grants that we walk and stay in that space. And so people ask sometimes, well, how does grant writing work? Like, how do you even start that process? And there are many ways to do that. And we'll just share kind of our approach. And then Kelly and I will talk a little bit about a recent grant we decided not to write and what that looked like too. So I think the biggest thing is to first start from an abundance mindset, like what do you have? And then find areas that you're kind of lacking in abundance. And we talked about those or shared those on the Kahoot. Finding a funder is another step in the process, and funding agencies fund specific things. And so you need to know kind of what you need before you go down the route of finding a funder. And then, you know, not every grant is a good fit. And one of the things I thought about a couple months ago in preparing for this workshop was like, what can I describe the grant writing process? Like, what is it like? And Kelly and I are both runners and we run races. And I think it's like running a marathon or it's running a race. And I'll talk a little bit more about that. And if you're not a runner, it might be something else that you kind of begin and end and train for. But there's a lot that goes into it. And we know a lot about who funds grants just based on our work and then what we have seen over the 20 plus years. You know, there's a ton of funding within the Health and Human Service Division for recovery and housing and MAT and clinical staff, all of those areas of need that you all described. But there are other funding sources as well. When I was looking at kind of funding that's happening in 2023, there's a lot. 1.7 trillion in year-end funding was passed by Congress at the end of December. And SAMHSA, which is kind of our go-to funding agency for a lot of things recovery, they have additional funding in 2023. So there's just a lot of federal funding. Is anybody in the class today funded by a federal grant? And if you are, if you can unmute your line or type in the chat box which federal agency you're funded by and maybe the name of the grant.
I'm Mark Hauer at Reality Check in New Hampshire. We've got 4 Fed SAMHSA grants. One's been shifted to CDC though. It's the biggest one is Building Communities of Recovery. And I am drug-free communities, I believe, is one of them. I should know these better, but I think we're on 4, and we're about to get a directed expenditure from our senator for recovery coaching classes and recovery coaching, or peer-assisted specialists is what we're supposed to call them these days. But anyway.
Okay. Wow. So you all are on the SAMHSA grant writing or your funding bus. You have funds coming in from your state. There's, I think, you know, when you start the work, and especially right now, it's kind of like a waterfall, or funds just keep coming, especially when you're doing really good work with a model like a peer recovery support model that is really effective. And so I love that. Congratulations on all of the grants that your organization has been able to get. And I hope, you know, the abundance just keeps coming. It will. Anybody else want to share a federal agency that they're funded by, or maybe you just submitted a grant and you're excited about it to a certain federal agency? Okay, well, feel free to type in the chat box. I'd love to hear who all is funded and what that has looked like. And Kelly put some examples in the chat box. Melanie Cobb said they're state funded, and a lot of times states receive federal funding. And Cynthia said that's why I'm here. Love it. Okay. And so when we think about preparing for the grant writing race or marathon, there are some questions that we need to consider. And I really think this process is so valuable rather than just finding a grant and trying to write it, because grant writing is very intentional. It's about, finding those abundance gaps and filling them. And also keeping people at the center of everything. That is absolutely essential. And so thinking about the population that you'll be serving, where they live, their different demographic characteristics, what places them at a higher need, and those kinds of things. And so one of the things that is also really important to consider with grant writing is your organization or program. And if we have a lot of nonprofits in the room, there is a process that you go through to be able to submit a federal grant. And we can provide some assistance for you offline about that, but you have to register, get an EIN number, and go through a series of steps, but it's definitely doable and possible. And the other consideration is just capacity to implement grants. And you might be the only person working in your organization right now, and you want funding to hire more staff. So thinking about the kind of grant that you're applying for, and if your organization is capable of doing that work, is another really important consideration. We always look at competition. If a client comes to our team and they're like, hey, we want you all to write this grant, and we look at it and it's they're only going to fund 3 in the nation, and it looks like it's going to go to an academic university, and we have ways of knowing that, then typically we say, no, we aren't going to be one of 3. We're good writers, but maybe, that's the odds are not in our favor. So we always want to see, a lot of awards that they'll make out of a certain grant. The other things we look at is the funder fit. So, what and who are funders typically funding. SAMHSA has a list where you can actually search every single grant they have awarded in every state and the type of organization that they have funded. And so that's really important too, in considering kind of, is this a good fit for our organization? Should we do it? And those kinds of things. And, out of all of this, you have to believe that it's possible. And if you kind of approach it like, oh, we're not going to get it, we are just starting out, then you probably won't. So again, that abundance mindset's really essential. Does anybody want to share maybe their process for thinking about the grant writing process, knowing their organization, anything we've talked about so far? I don't like to do all the talking, but I'm happy to do all the talking if nobody else wants to talk. So we're going to move into this question of, another question we get a lot of times is, where do we find grants? And, there are grants everywhere. And with the World Wide Web and all of these emails and listservs and LinkedIn and broadcast, it can kind of be overwhelming sometimes, but again, it's abundance. A lot of times we find grants on grants.gov. Also the Federal Register. States are increasingly posting grant opportunities. It sounds like we have a lot of state-funded organizations in the room today. And so states have their own websites. Nonprofit organizations do as well. One of my favorite websites, I've been on it before, but I was looking at it last night, is the Rural Health Information Hub. You might not be rural, but they have a ton of recovery and nonprofit grants, and they keep it posted regularly. Also, the National Network to Eliminate Disparities has been around for a long time, and they have a really nice website that lists federal and nonprofit grant opportunities. And there are many other places as well. So we're going to kind of look through those and just give you some examples. This might be new to you, it might not be, but the first screen here is just a summary of grants.gov. And you can search grants based on keywords. You can also do forecasted or posted. Forecasted means that the funding agency, let's say SAMHSA, is planning on posting a grant in the future. And then a posted grant is something that is available now. You can also look at the funding instrument type. Is it a cooperative agreement? And cooperative agreements actually include a lot more funding agency participation, where a grant is really about them giving an organization funding, and that organization implements and carries out the activities with not as much funding agency involvement. And you can also sort by eligibility, if you're a county, if you're a for-profit, nonprofit, etc. Somebody asked, do federal agencies fund individuals? And typically they do not. I haven't seen that, but there might be an exception if you have a really good idea or it's a really unique funding agency. So you can spend a few days in grants.gov just searching around different grants. You can also search by agency, and of course HHS and SAMHSA are often funding recovery work. The Centers for Disease Control, somebody mentioned them. They're another funder, as well as the Department of Justice, DOJ, and the list kind of goes on.
Another big one, Allison, another big one for RCOs that I hear frequently people getting funding is HRSA.
Yes. Oh, thank you. Yes. So HRSA would show up as well in the agency, and you could also search by HRSA as the funding agency. So thank you for sharing that. And I think they have some funding available right now for behavioral health workforce development that I came across. So, and HRSA is, what is that? The Health Resources Service Administration or something. Somebody will type it in. Because Vic would like to know. Okay. So yeah, and if we have time at the end, we can do kind of a screen share search grants process. And Melanie, thank you for being here. Glad you could show up. So Federal Register is another website that we go to for different grant opportunities. Sometimes we'll see, read a newsletter and it'll say like this was posted in the Federal Register. Most times grants that are posted in grants.gov are also posted in the Federal Register. And here's an example of one that was posted. It's for transportation. You can look at a PDF, publication, etc. This is an example of a state grants website. I pulled up California, and then that's where Kelly's at, and I also pulled up Oregon because that's where I live. I bet that whatever state that you're living in, they have grant funding, and I bet that funding has something to do with recovery and healing. I don't know how much it will be. We have a program at a healing center in Wyoming that the state of Wyoming receives state opioid response funding. And so through that funding, we get, we call it SOAR funding, and that funds a lot of our training some of our clinician work and outreach. And that grant through the state of Wyoming was not competitive. So really it was about having a conversation with the state, them liking what the Healing Center is doing, and then them giving us funds. And those funds are coming back every year. So sometimes there are funds that come to organizations that are really easy to get. Not saying that'll happen to you, but it does happen. But even in those examples, like the SOAR example with the state of Wyoming, you have to have something written out about your organization and go through that process we outlined earlier. So, you know, private funding is another source, and there are so many different ways you can get private funding. And there are benefits to private funding, but there are, I think it's harder to find, I think, sometimes a match for what you want to do and a private funder that will fund that, but it's definitely possible. And the benefits are that generally it's less competitive. It'll fund multiple years. I've seen private funders funding organizations for 10 or 15 years consecutively every year. And a lot of times those amounts are higher because the funding agencies really believe in the work and they want to be a part of it. And community foundations are another example. This is the Community Foundations locator. You can search that on the web. And I can also put it in the chat box. It's here, but this is just another way to find out kind of what foundations are funding recovery work. And all of these slides will be available as well if you want to look at them in more detail. And then, you know, there's also grant databases that require payment. I don't want to spend a lot of time on these because we actually don't use them. I've never paid anybody to get access to a grant database. Has anybody in the room done that? I'd love to hear your experience if you have. So these are some examples. I know Chris looked at one and it was like $5,000 or $6,000 a year. But they are available if you're wanting to go that route. And I want to just do a quick story real quick about a recent project that Kelly and I worked on, and then we'll take like a 5-minute break and come back and do an activity. And so, does that sound okay with everybody? Okay, Elizabeth says yes, so we're going to go with it, Elizabeth. So let me just end the slideshow here, stop share. So you're looking at Kelly and I. Okay, so, you know, so far we've kind of talked about where you're at, areas of abundance. We've done a really brief overview of the grant writing process, where you can find grants, and it's a race, right? But then sometimes you're going to drop out of a race. You're going to quit and end early. And so we just did this a couple of weeks ago, and it was kind of painful. Kelly, I'll have you kind of chime in here. So we were approached by a client to write a foundation grant. And this foundation was very specific. They would only fund South Dakota, North Dakota, and Minnesota. And it had to be really innovative work. And so we met several times with the client, and we started writing and meeting with people and trying to figure out how we were going to really sell their work so they could get funding. And it was how much money was it, Kelly? Do you remember?
It was $500,000 for a few years.
And so Kelly, and this is like the process that you go through, right? I mean, even if you're not hired to write a grant, maybe you're on staff and you're writing a grant, you're trying to get your leadership to support it or get people to get on board. And so Kelly, you created that outline in Google Docs. Would you mind sharing that just for fun? Because I really liked it. we're in this process of changing everything to Google Workplace, but Kelly, being the amazing, efficient person that she is, she created this Google Docs web document. And that was important because a lot of foundations require online submissions. So you're not like uploading anything as a PDF file. You're just typing information into a portal that's then submitted. And so Kelly created a document that has all of the questions that we had to answer. So she's going to share that now. And you can see like how it looks. So it was a Bush Foundation collaborative grant, again, $500,000. And we were trying to figure out how we could make this work. And there were certain things that they wanted, like tell us about how you'll build solutions to the issues in your community, or what sets your organization apart in your field. And so these are things that are important to be thinking about, even if you don't have a grant identified yet. But what we ultimately decided was that this wasn't going to be a go. We were going to have to drop out of the race because we didn't have enough evidence or capacity really to write this in a way that it would be funded. And so Kelly, what else am I missing from that story?
Yeah, so I think when we initially looked at the grant, you know, it was, I believe, 3 years, 500,000. So a pretty sizable foundation grant. But we had to demonstrate, they were kind of giving you funds based on your previous work. So I think that's really innovative with foundations, is that they were going to fund them based on innovative work that they had done in the past. And so we needed kind of documented evidence that was within these 3 states in the country, as well as projects that were not originally federally funded. So there's kind of small caveats you always have to look at in foundation grants in terms of eligibility and federal grants. When we're looking at federal grants, eligibility is kind of first and foremost what you want to look at, as well as how many awards that they're offering, like Allison shared earlier. So something we noticed is that organization does great work in kind of Indian Child Welfare Act nationally. They do some work nationally for ICWA, and a lot of their funding was federal. And we had to be very specific about how they worked within those 3 regions of the country on projects that were not federally funded. So there were some concerns about eligibility. There was difficulty documenting evidence that they had worked in those regions and innovative approaches within just those 3 states, because they've done really innovative work and incredible work nationally, but those 3 states had limited impacts that we could speak to that wasn't federally funded. So eligibility, I would say, was a big thing to always look at before you put your time into even outlining a grant or even starting that process.
Yes, well, and like that, you're totally right. So I guess we share that story because we've been doing this a long time, and even we drop out of the race. So it's okay. It's better to do that than to like keep on going in the race and not finish well, not get funded. So anyway, we're going to take like a 5-minute break, and when we come back, we're going to search grants, and we're going to find a funding source that you can use in your work to get the funds you want to create abundance. So we will do that at, let's see here, maybe 11:05. So in 5 minutes, we'll come back and we'll start searching for grants that might work with your organization. So we'll see you in 5. Thank you.
So it being hardest for your first grant. So we talked about, you know, really that first grant is always the hardest to get, but that builds your organizational capacity and makes it easier to get grants down the road from federal funders. And then we talked about some looking for foundation grants for smaller type of work where it's more community-based, more volunteer-based currently, where they might not have the capacity to write a federal grant that's in all, you know, 20 pages narrative and many attachments and letters of support. If you don't have that capacity, then starting with foundations is a really good place to start.
Yay. Okay, well, and we didn't get, in our group, we kind of just looked at a couple of different grants websites, but we didn't get into like searching for a grant specifically. So I have an idea for that for our homework they'll share. Does anybody else want to share just anything about the search process or any questions you have about that so far? I feel like it's kind of quick, I know.
I have a question. So what I'm noticing is a lot of the grants are already closed. So is there a specific time of year that they generally are open, and then, you know, people go, oh, okay, the spring or the fall and the winter is when most of them are open, and then the spring they close? Like, what is the rule of thumb pretty much for when we should really be looking?
Yeah,
Is there?
that's a really good question. And historically, there was like a SAMHSA Christmas time where it was like all of the SAMHSA grants were like posted in February and March, and then you'd get notice of funding in July, and you'd start like September 30th. But what I have noticed, and Chris and Kelly, you might have different experiences, but because there's so much funding with SAMHSA, that it's changed. Like, it's not just like, oh, in that time period. Like, we have some of our grants, like a behavioral health grant, Partnerships for Success, those start dates are in July, and they were due like in December. You know, so it really just depends. I would recommend checking them all of the time, and then also looking at that forecasted, what SAMHSA is forecasting for 2024, so that you know, like, it was due in June 5th, 2023. It'll probably be due June 5th, 2024. And that's where that forecasted piece kind of comes in.
I add to that, because in our group, I noticed that you were looking at the samhsa.gov. And in my experience, when I find there are very few grants at samhsa.gov, I expand my scope of search to grants.gov. So if we were to look at grants.gov, I believe we would find a whole heck of a lot more that aren't closed.
Yeah. Thank you for bringing that up, Brian. And grants.gov will have all of the federal grants, and SAMHSA, of course, is just putting their grants on there. So that's, you know, if you're not finding what you want in one place, go to the other. It's kind of like you're digging for gold, or like, you know, it's like a search. It's kind of fun, actually.
But grants.gov will have SAMHSA's grants as well, right?
Yeah. Yep. And they'll have any federal grant. They'll have a lot of, like, we found one for HUD that would fund youth homelessness and prevention, and that's due in a few months. So yeah, there's all different federal grants out there. And so we're going to keep on cruising. There's a couple of questions in the chat box from Haley. The difference between discretionary and non-discretionary funding. In my experience, Haley, that just is basically where the funds are coming down from Congress and how they're allocated. So for example, the 988 grant that we're applying for that's due on July 18th, that comes from discretionary funding. So Congress is saying, we need these funds, they're really important. It wasn't part of this larger set aside for funding of 988 response. So it's just different ways that the funds are set aside at the federal level based on a high need or something that's happening, might be the opioid crisis, etc. And there's more to it than that, so I can give you some examples online, but I wouldn't be too concerned about if it's discretionary or non. I would be most looking at, like, is this an organization that will fund our agency? Have they funded in the past? Those kinds of things. And block grants versus other types. We can definitely follow up with you on that, Lisa. I'm just going to take some notes because I know we won't be able to get to all of this. But we have another session. So if you're feeling like you didn't get what you need, come back. We have some homework and some other stuff. Michael wants to know, what types of information should we have to prepare for a grant? We're going to get to that right now. So let's just, let's see here, share the screen. And hopefully you all can see that. It always feels like 90 minutes is a lot, and then it's never a lot. So, and Kelly, can you see my screen okay? Okay. So one of the things that, you know, there are lots of steps we go through in finding a grant, and we'll send you a couple of outlines so you can practice. But it's important to kind of think about where you're at within your organization and what you need. And these 7 steps or components are what almost every single grant that I have seen include. There might be more, but this is kind of it in a nutshell. When you start and end the grant writing race, just a couple of tips. Make sure you know the deadline, the finish line requirements, the team. I don't recommend writing a grant on your own. You need probably at least 1 other people to help you to review it. Think about internal deadlines, and also if you're even registered like in SAM or ERA, and how to do that. So there's some steps that you'll want to take along the way. And we've got some great ideas about how to organize writing a grant, and we shared all of these in a Dropbox file. We'll make sure you all have. This example here just outlines the application requirements for a CDC grant, and where information is located on the notice of funding, and then the team lead, so who will actually be writing that. And this is important if you're writing it collaboratively with other people. And there's a couple of lessons overall. I feel like this is a super quick kind of look at grant writing, but you know, it's important to begin with the end in mind, so you're starting and finishing the race. Make sure you have the right people in the race. Keep things real, and know that you can always do better. I mean, these are lessons that we have learned. There's a couple of options for homework, and I know you all probably are thinking like, why homework? I have way too much to do. But we wanted to give you 2 options. The first is to review a federal SAMHSA grant application that we wrote a couple of years ago that was funded. And just look at that and think about the application. What are the strengths, weaknesses, etc. The next option is actually to write a grant, and we have some brilliant people in the room, so why not write a grant, or at least get that process started. And so there is a Dropbox file, and Kelly and or Chris, I don't know if you could put that link in the chat box, but this is what we have put together for you. The first is just the homework from our session today. And it gives you examples and what to do. And we want you to bring that back to the next session. Then we have the PowerPoint from today. And then we have, this is a SAMHSA grant application that we wanted to share. And so it has a project narrative, an abstract, all of the attachments, the budget justification, and some other required forms. And so we wanted to share this with you today because this funding application, the SAMHSA Partnerships for Success, is an amazing grant that will fund prevention activities and staff in your organization. And we've been working on PFS grants for about, I don't know, 10 or 15 years. And they really are amazing. So my dream is that everybody on the call takes this application that we're sharing and you write it for your own organization. There's also attachments that you will see here. And these are what we're required to submit the grant, instruments that we're going to use, consent forms, and how we're going to collect data and those kinds of things. I'm going to stop now because I know we just have a couple minutes left, and just ask you all if you have any questions or anything that you'd like us to touch on before we close today.
I wanted to ask, you've shown us a lot, and then I've seen a lot of stuff in the chat. Most of this stuff will be available on the website. Is that correct? The Peer Center for Excellence's
Yeah,
website?
Michael, and I'll send it out right after today's session in an email so that nobody has to wait because sometimes it takes a little while to get posted to the site. So
Okay.
everything we've talked about, I'll download the chat. I'll highlight some specific links. I'll put in I know Allison has mentioned like having a DUNS number, a SAMS number, like these different places I know of that you have to register before you can apply for these grants. And then make sure you have a link to the Dropbox so that you can review all this great work Allison has made available to us so that you'll kind of have a nice little package in an email of like, here's all the stuff.
Great. Thank you.
Yeah. And I think
Yeah.
we're at our time, Allison and Kelly. That went quick.
Oh my goodness, yes. So thank you all for being here. We didn't get to the prizes, so maybe we need to do participation prizes. So Michael, it seems like you have been super present and willing to share. So if you can send us your address, we would love to send you a gift of abundance from our AKA team.
Oh,
And Candace has been a stellar participant as well. So Candace, if you can send us your address, mailing address, we would love to send you a gift of abundance.
And let's make sure I'll
Thank
put
you.
their email in the chat here, Michael and Candace, so you don't feel like you have to
oh, okay. Thank you.
put where you
Thank
live.
you.
Yeah.
So there's
Well,
Kelly's email address, so you can send her your mailing address for those prizes. Thank you so much, everyone.
Thank you.
And look for that email. It'll probably take me a half hour or so to type it up and get it out to all of you. And then Tammy, did you have a question?
Yes, I do. Just really quick. In your experience with Kelly or Chris or Allison, have you noticed that once so starting off a nonprofit right off the ground and they already have the 501c3 status? I mean, everything's into play. Is it easier and quicker to get those grants approved with that, with everything in play?
It all depends, right? And so having your 501c3 is oftentimes a requirement of a lot of these, especially those federal or oftentimes state grants. And then there's these additional SAMs, DUNS, these numbers that can take 6 to 8 weeks to get. So it's kind of about having your ducks in the row. And then I want to point out what Allison said earlier too, like we know SAMHSA put out the Building Communities of Recovery grants, and I believe those require you to have been a 501c3 2 years before you can apply for the funds. Or, maybe only 10 awards are going to be made. We know those are national, so it's highly competitive. It doesn't mean don't apply, but sometimes then you want to look at your city, county, or state level grants to get that first infusion of funding so you can do some services, collect some data, demonstrate all the good work you're doing, and then those larger grants become more accessible.
Okay.
And we'll be back with you, I think, is it next week?
25th.
25th. Thank you. We'll be back with you for part 2, and Kelly and Allison and I will look through the chat and make sure that we address those questions that were left there. And I just want to do a big thank you for Kelly and Allison, because I know this is a big topic. And I appreciate your wisdom and expertise today.
yeah, thank you all. And we are online and available if you all just want to work with us one-on-one to get something going. It just takes like it's totally doable. I guess that's the message in creating abundance. Like we have abundance and it keeps coming. And so let us know, send us an email, and we're happy to work with you. And we won't even charge you. How's that? Like a lot of grant writers are like, pay me. And how do you do work if you don't have any money? You need a grant. So it's all in the spirit of generosity. Yeah. So let us know what you need, and we'll also, there's some other examples, I think, because we have such a new group of grant writers that we can put in that file, Chris, that will really help people.
Awesome. Well, thanks so much, everyone, and we'll see you on the 25th. Look for an email from me with follow-up info.
Okay.